Hey, welcome to Socialism for All. Today's date is Saturday, April 4th, 2020, and I am trying to catch up on several stories today that I planned a few days ago, and then time got away from me. So this first story is about the Democrats' failure to support Medicare for All and to adopt a systemic approach to healthcare in America in the face of the COVID-19 epidemic. Before I get into that story, I want to just ask you real quick, hit the like, share, subscribe, comment. All that stuff helps to boost this channel and helps more people see this nice socialist content. So that's appreciated. You can also follow us on Facebook or on Patreon, sponsor for as little as $1 a month. Okay, so the story. I opened Twitter today and I saw that Shaun King was trending for a racist epithet, Talcum X. So Shaun King is a Bernie Sanders supporter and journalist. You know, not perfect, but I do not like seeing racist gangbangs on Twitter, really under any, whether they're socialists or not. That's just not something I support. So I clicked on the trend to see what was going on. And as you can see here in this screenshot, Shaun King had an exchange with Hawaiian Senator Brian Schatz, a Democrat. Schatz tweeted out, "We are seeing preventable mass deaths in the United States." Shaun King asked him, "Do you support Medicare for all right now?" Schatz said, "I don't know why you are tweeting this like some sort of gotcha, but I'm a co-sponsor of the bill." So liberals took this as like a sick burn on Shaun King and started dragging him, and that's why he started trending. And then the alt-right joined in with a bunch of racist slurs that they usually use on Shaun King because he is kind of light-skinned for an African-American man, so they mock him. So there are a couple of key words in King's tweet, though, which are right now, meaning it's really easy to co-sponsor and then totally forget a bill. It's pretty much the definition of legislative lip service. So there is a candidate in the Democratic primary, Bernie Sanders, who does not take 1% money, and the entire rest of the party does and is owned by that money. Socialism for All does not promote electoralism. We do not think that you can vote in socialism. I would sure like to get people benefits, though. No, I don't necessarily think Bernie Sanders is a path to socialism. I do think it's better conditions for us to push for socialism. I do not think anything short of revolution is going to bring in socialism. But healthcare is not socialism. Healthcare is healthcare, right? So coming back to the Shaun King situation, I decided to do a little bit of research on this. And I looked through Brian Schatz's Twitter feed going back about a week and a half to, I think, March 25th. And guess what? He doesn't mention Medicare a single time. Obviously, in the last 2 weeks, we have had a lot of debate in the United States about Trump's response to the coronavirus pandemic. Has enough been done? We need supplies. We need funding for workers, all that stuff. But in the midst of that, is he also calling for a look at the system? Because we know that the Democratic frontrunner, well, propped up by the 1% owned media, Joe Biden, Veto Joe, has said in recent TV interviews, I think 3 times in the last couple of weeks, that he would veto Medicare for all, citing cost and it's the same how are you going to pay for it nonsense. When we've seen from their coronavirus response, you can afford anything you want. They just print the money. They just add another zero. They just add another decimal place, basically. So, I look back there, even in Schatz's feed, there are some tweets supportive of Joe Biden. There is absolutely nothing about Medicare for all. So Shaun King was 100% right to call on Brian Schatz. So then I decided, well, why stop at Brian Schatz? Why not look at all of the other co-sponsors of Bernie Sanders' Medicare for All bill of 2019? So this bill comes down to, there's a Senate version and a House version. Introduced in the Senate by Bernie Sanders on April 10th, and it has picked up a little bit over a dozen senators: Tammy Baldwin, Richard Blumenthal, Cory Booker, Kirsten Gillibrand, Kamala Harris, Patrick Leahy, Edward Markey, Jeff Merkley, Brian Schatz, Tom Udall, Elizabeth Warren, Sheldon Whitehouse, Mazie Hirono, and Martin Heinrich. There are over 100 co-sponsors in the House. So I really can't go through all those. I'm just one guy trying to catch up on some socialist videos here. But there was also a House version of this bill introduced in February of 19, just in time for the primaries, as kind of like a baseline and a standard to see how the Democrats would line up with this bill. So obviously a lot of people, like 130 people, co-sponsored this bill. Do you hear 130 Democrats every day or even every week calling for this is why we need Medicare for all? No. They are taking the Joe Biden line of COVID-19 is just this like one-time crisis. We just need to handle this crisis and basically contrast our handling of this crisis with Donald Trump's handling of this crisis and score political points that way, and never really look at capitalism and the system that brought us to this place. So I did the same kind of content analysis on the feeds of Tammy Baldwin, Richard Blumenthal, basically everybody who co-sponsored this with like 4 exceptions, because I was just getting the same results like every time. I didn't do Edward Markey, Tom Udall, Sheldon Whitehouse, Mazie Hirono, and Martin Heinrich, but I did the others. And guess what? Not a single one of them called for Medicare for all once. I will show you the screenshots of what they were talking about related to COVID-19 and supplies and healthcare workers and all that kind of stuff and the CARES Act. But none of these co-sponsors is calling for Medicare for all. So I think that this proves the point that you can co-sponsor something and then, try to own critics by saying, well, I co-sponsored it. Yeah, but then you haven't done a single thing for it. Versus Bernie Sanders' feed, where he's just going back to April 1st, he made 6 tweets about Medicare for all, and he's actively fighting for it. So let's get into the tweets. Here's a recent tweet, April 3rd, Tammy Baldwin. Things Trump could do right now to help uninsured Americans during this crisis. Open a special enrollment period for ACA marketplaces and end the lawsuit to repeal the ACA. This is one of the party lines right now. So don't fight for Medicare for all. Don't criticize the system, the healthcare system, let alone capitalism as a whole that put us in the situation where everybody's, on breadlines now. I literally went to the supermarket the other day. There were 50 people lined up outside, 6 feet apart from each other. It was crazy. And I don't live in a major metropolitan center by far, so that was pretty shocking. But anyway, this is the Democratic Party line right now, or one of them, that just open a special enrollment period for the ACA. It's like a very, very limited goal that you see a lot of tweets about. Hillary Clinton just tweeted about this the other day. Trump's not opening a special enrollment period. That's basically the Democratic Party's response right now. Another tweet from Tammy Baldwin, April 1st. It is heartless for real Donald Trump to lock out the uninsured and underinsured in Wisconsin from having a chance to purchase an ACA plan during this public health crisis. ACA, of course, being Obamacare. And then this lack of leadership from POTUS will make things worse, not better. Affordable health care coverage, blah, blah, blah. I went back through the Twitter feed. This was about as incisive as it got. So there's a co-sponsor not talking about Medicare for all when it matters most. So here we have Cory Booker. Couple of tweets here. April 2nd, as millions of people find themselves without access to health care, child care, paid sick leave, and much more, this pandemic has revealed what we already should know. Injustice anywhere is indeed a threat to justice everywhere. That was in response to a tweet that said, just to be clear, if it took a global pandemic to make you realize that our systems are broken, that is a privilege. Okay. Another tweet, April 1st, uninsured Americans should at least have the option of obtaining coverage on the federal exchanges. In other words, this is another ACA special enrollment period. Another one from March 23rd. Thanks to Barack Obama's leadership, millions more Americans now have access to quality, affordable health care. On the 10th year anniversary of the ACA, let's commit to defending this progress and finding ways to expand coverage even further. Again, though, way too timid to call for Medicare for all. Even if you're going to say the ACA was some kind of necessary stopgap, it wasn't. They could have at least put a public option in at that time, let alone just fought for Medicare for all then and led public opinion on that. They chose not to. They gave us the right-wing Heritage Foundation private insurance plan, which is Obamacare from the 90s. Cory Booker also recently This must have been on April 3rd. In the midst of a public health crisis, we should all be able to agree that access to healthcare needs to be expanded, not taken away from millions of people. The relentless attacks on the ACA must end. And then another tweet, March 26th. This deal includes top priorities that we fought hard for, like a Marshall Plan for hospitals, et cetera. So that's another thing that you see a lot is supplies for hospitals and healthcare workers. But so that's Cory Booker's feed. There's nothing about Medicare for All. So he's a co-sponsor. Let's look at Kirsten Gillibrand. We have a tweet from March 30th about many domestic violence service providers predict an increase in domestic abuse amid shelter-in-place orders because people experiencing domestic violence can't get out of the house as easily, go to work, spend the day outside the house. Okay, there's another tweet there from March 29th. If our healthcare workers can't stay healthy, the rest of our response to this crisis will collapse. They need the masks, gloves, and other personal protective equipment. Okay. Let's see. March 31st, women across the country are risking their lives on the front lines of this pandemic, serving as doctors, nurses, first responders. We need equal pay for women. Okay. We have Kirsten Gillibrand appearing on MSNBC to say right now the country is in a healthcare crisis and people need to stay home and change the way life is right now. It's what they could do for the country and vulnerable populations. What else do we have? Another one about domestic violence victims. So again, here's a co-sponsor of Medicare for All, not doing jack shit to promote Medicare for All. And again, Medicare for All, this is highly controversial. No one in the 1%, more or less, wants Medicare for All, and they will throw their entire weight and billions of dollars trying to stop it. So it needs people to fight for it. It's real easy to say, oh yeah, I co-sponsor that, and then do absolutely nothing. So here's the next in the roster of fakers, Kamala Harris. April 1st, the Trump administration turning their back on uninsured Americans in the middle of a pandemic is completely indefensible. And this is, again, about not opening the ACA exchanges for a special enrollment period. Definitely the party line right now. Kamala Harris, April 2nd, 6.6 million people filed for unemployment benefits, and we need to give some financial support to them. Also a tweet from April 2nd. This pandemic has exacerbated the health, education, and economic disparities that have disproportionately impacted communities of color. Again, she appeared on TV for that one. March 31st, during this crisis, service workers and gig workers need more protection. We have yesterday, the 3rd, healthcare workers are on the front lines taking care of us. We need to fund childcare for them. March 24th, the U.S. surpassed 50,000 confirmed coronavirus cases today. Leadership is putting American lives before Wall Street profits. So again, I went back to the same timeline. Nothing about Medicare for All. But we knew that because she already, back in the Democratic primaries before she dropped out, already flip-flopped on it. Patrick Leahy is another one. So yesterday, as COVID-19 spreads, including in our nation's detention facilities, ICE needs a comprehensive plan, adhering to CDC guidelines and best practices to contain it fast. Vulnerable detainees who pose no public safety risk should be released. Senate Democrats refusing to be jammed by Senator Mitch McConnell into accepting a bad bill. We fought to put our healthcare system, people, and workers first and made the bill much better. That's a Leahy retweet of Chuck Schumer on the 27th. Another retweet from the 28th. Healthcare workers risk all to save us. We cannot fail them. And then a lot of Leahy's Twitter thing redirects people to a page on his website about coronavirus information that you're seeing here. There's nothing about Medicare for All that I could see. Moving on to Jeff Merkley. Merkley does not tweet a lot. I got back to March 20th on him. Why is real Donald Trump dragging his feet on initiating the Defense Production Act? Our frontline healthcare workers and first responders need protective and intensive care equipment. Okay. When it comes to masks, ventilators, and other critical equipment for healthcare workers, the president says state and local governments should get it yourself. I refuse to tolerate that. Okay. So Merkley doesn't tweet a lot. So that was Merkley. We have Elizabeth Warren. Our obligation, our moral imperative is to save lives. If people are forced out of their homes too early and thousands or millions more people die because hospitals and healthcare providers are overwhelmed, there won't be an economy left to save. Also, we have a twofer there, retweet of Barack Obama on the 23rd, 10 years ago today. I signed the Affordable Care Act into law. It protected blah, blah, blah. We know what it did. April 2nd, Elizabeth Warren, Donald Trump must reopen the federal Obamacare exchanges now. April 1st, insider trading to profit off of a pandemic isn't just morally reprehensible, it's illegal. So we see like different angles. Gillibrand has the woman angle, Harris has the race angle, Warren has the anti-corruption angle. Like they all have their brand, but these are, I hope you can see by these trends, like all kind of the same pattern. They're all the same kind of marching orders and talking points. Warren again on the 26th, profit margins don't come before people's lives. But I, again, went back through her feed for a week and a half or 2 weeks. I didn't see a single thing calling for Medicare for all. We already know that was one of the reasons Warren tanked in the primaries, that she flip-flopped on Medicare for all, trying to make it into like a two-pronged. First, we're going to fight for public option. Then 3 years later, we're going to fight for Medicare for all, which a lot of people rightly decided was like a total loser of a plan. And it made people doubt her commitment to the whole thing. Warren has tweeted a fair amount, actually. I got like 8 screenshots of her feed. Let's see, on the 25th, we have more work to do here to fight for this pandemic and help workers and families weather this crisis. This isn't the time to take a recess, talking about Congress. She has another one, March 30th. We need to be doing everything we can to avoid a housing crisis, and Julian Castro has a plan. Also on the same page, March 30th, I'm supporting Instacart workers on their strike today. They provide an essential service. So not all these are terrible points, okay? And I'm not trying to say that. But where is Medicare for all? You have people who co-sponsored Bernie Sanders' bill, and it's like they're systematically avoiding. I also did Richard Blumenthal. I'm not even going to bother putting those up. It's the same thing. Defense Production Act. We need a Marshall Plan for hospitals, all that kind of stuff. But it's the same thing. So coming back around again to Shaun King, do you support Medicare for all right now? Well, let's go to Bernie Sanders' feed and contrast those. So we have a tweet from Bernie Sanders from the 3rd. Your health care cannot be tied to your employment. It has to be seen as a human right. Same day, actually on Bernie Sanders' feed, I only had to go back to April 1st to find like 6 tweets about Medicare for all, healthcare is a human right, etc. That seems relevant to me during a pandemic, right? I don't know how you could argue that it isn't, yet you see all these Democratic leaders, many of whom participated in the Democratic primary, not talking about this. Instead, they're treating it like a one-time crisis rather than a recurring crisis, because that's what capitalism is. It has boom and bust, like, every 10 or 15 years. It puts us into a huge, huge crisis. So Bernie Sanders, at a time when millions are losing their jobs and their health care, the American people are now seeing the gross deficiencies in our employer-based private healthcare system. Healthcare is a human right, not an employee benefit. We need Medicare for all so that your health insurance is not tied to your job. Let's see, April 1st, I support workers who strike, conduct a sick out, or participate in a walk-off to support our collective health and safety amid this pandemic. Period. April 1st, a Medicare for all system is designed to provide quality care to all, not simply make huge amounts of money for insurance and drug companies. So I'm going to leave it there because I think you can see the clear contrast. You see on the mainstream Dems and Joe Biden as well. I didn't go into Joe Biden's feed, but we know that he went on TV several times saying, we don't need Medicare for all. He said during the most recent Democratic debate against Bernie Sanders that Medicare for all wouldn't help at all right now. Well, actually, Time Magazine did a story that somebody got corona testing and treatment and they got a bill for $35,000. Why would people go get testing and treatment if they're going to get stuck with a bill that they can't afford? Medicare for all absolutely would deal with that. Not only that, the Medicare for all system would, and that bill goes into making sure that we have public medical infrastructure and hospital funding and all this kind of stuff so that people can go reliably and get treatment without worrying about it. Now, I want to read the Bernie Sanders summary of the Medicare for All Act of 2019, because this is key. And I think the phrase Medicare for all gets thrown around a lot. I just want to get this on record. I've been doing a lot of audiobooks on this channel. This is a 4-page PDF summary, and I think people should just know more of the details of what we're talking about. So I'm going to get into that right now. The Medicare for All Act of 2019. Our dysfunctional healthcare system is unaffordable. Today, the United States has the most expensive, inefficient, and bureaucratic healthcare system in the world. Despite the fact that we're the only major country on earth not to guarantee healthcare for all, and have 34 million Americans who are uninsured and even more who are underinsured, we now spend more than twice as much per capita on healthcare as the average developed country. According to a recent study, 45% of Americans are worried a major illness could leave them bankrupt. 1 out of 4 Americans skipped needed medical care because they could not afford it, and 77% are concerned rising health costs will cause significant and lasting damage to our economy. We spend more on healthcare and get worse results. According to the Centers for Medicare and Medicaid Services, we spend more than $10,700 per capita on healthcare. Meanwhile, Canada spends just $4,826. France spends $4,902. Germany spends $5,728, and the UK spends $4,246 per person on healthcare. Further, despite the fact that healthcare spending consumes almost 18% of our GDP, our healthcare outcomes are worse than all of these other countries. For example, our life expectancy is 2.5 years lower than Germany's, and our mortality rate for children under the age of 18 is at the top of the list compared to other developed countries. Our current healthcare system puts profit over people. The ongoing failure of our healthcare system is directly attributable to the fact that, unique among major nations, it is primarily designed not to provide quality care to all in a cost-effective way, but to maximize profits for health insurance companies, the pharmaceutical industry, and medical equipment suppliers. While thousands of Americans die each year because they cannot get the health care they desperately need, the top 5 health insurance companies last year made $21 billion in profits, led by United Health, which made almost $12 billion alone. Comment, these numbers aren't even real to me. Can you imagine having $12 billion? Okay, moving on. As tens of thousands of American families face bankruptcy and financial ruin because of the outrageously high cost of healthcare, and 30% of U.S. adults with private health insurance delay seeking medical care each year due to cost, the top 65 healthcare CEOs made $1.7 billion in compensation in 2017, including $83.2 million for the CEO of United Health Group, $58.7 million for the CEO of Aetna, and $43.9 million for the CEO of Cigna. Comment, that CEO of Cigna is really getting screwed, huh? Today, about 1 out of every 5 Americans cannot afford to fill the prescriptions given to them by their doctors because we pay by far the highest price in the world for prescription drugs. Meanwhile, last year, pharmaceutical companies made over $50 billion in profits. A 2013 study showed that in 2010, the United States paid, on average, about double what was paid in the UK, Australia, and Switzerland for prescription drugs. Since 2014, the cost of 60 drugs commonly taken has more than doubled, and 20 of them have at least quadrupled in price. Medicare is the most popular healthcare program in America. 54 years ago, the United States took an important step towards universal healthcare by passing the Medicare program into law. Guaranteeing comprehensive health benefits for Americans over 65 has proven to be enormously successful and popular. Now is the time to improve and expand Medicare for all. Comment. I may do a story at some point about why we didn't get a Medicare for all type system back in the 30s or 40s, which is when most of the other Western capitalist imperialist countries got a national healthcare system. Short version of the story is that the AMA, the Doctors Association, lobbied furiously, saying that it was a communist takeover of healthcare, and they voted out they lobbied their individual doctor members to vote out every single person in Congress who was pushing for it. We then got Medicare, Medicaid in the 60s as part of the Great Society program, but that's why we didn't get it back in the first place. I may cover that in greater depth later on. Universal health care for all. The Medicare for All Act will provide comprehensive health care to every man, woman, and child in our country without out-of-pocket expenses. No more insurance premiums, deductibles, or copayments. Further, this bill improves Medicare coverage to include dental, hearing, and vision care. In other words, this plan would do exactly what should be done in a civilized and democratic society. It would allow all Americans, regardless of their income, to get the health care they need when they need it. Medicare for All is the most cost-effective health care plan. Instead of doctors and nurses spending a significant part of their day filling out forms and arguing with insurance companies, they should be using their time to provide care to their patients. We'd be able to save up to $500 billion annually in billing and administrative costs under Medicare for All. That money could be used to greatly expand primary care in this country and make certain that all Americans got the health care they needed when they needed it, saving billions on expensive emergency room care and hospital visits. Instead of paying the highest prices in the world for prescription drugs, we could save hundreds of billions over a 10-year period through tough negotiations with the drug companies under this legislation. Comment: the United States is the only country out of the advanced imperialist countries that does not annually negotiate its medical budget with providers. The only one. That's why prices are so high. Even a study done by the right-wing Mercatus Center estimated that Medicare for All would save Americans more than $2 trillion over a decade, reducing the projected cost of health care between 2022 and 2031 from $59.7 trillion to $57.6 trillion. Another study by the University of Massachusetts Amherst estimated that Medicare for All would save the American people even more money, $5.1 trillion over a 10-year period, compared to what they're spending today. Medicare for All saves middle-class families thousands of dollars. At a time when healthcare in 2018 for a typical family of four with an employer-sponsored PPO plan now costs more than $28,000. $28,000. The reality is that a Medicare for All system would save the average family significant sums of money. A study by RAND found that moving to a Medicare for All system in New York would save a family with an income of $185,000 or less about $3,000 a year on average. Citizens for Tax Justice found that middle-class families would see their after-tax income go up by about $3,240 a year under Medicare for All. Another study found that middle-class families would spend about 14% less of their income on health care than they do today. Even the projections from the Mercatus Center suggest that the average American could save about $6,000 under Medicare for All over a 10-year period. Medicare for All is good for business. A Medicare for All system not only benefits individuals and families, it would benefit the business community. Small and medium-sized businesses would be free to focus on their core business goals, instead of wasting precious energy and resources navigating an incredibly complex system to provide health insurance to their employees. Bottom line, if every major country on earth can guarantee health care to all and achieve better health outcomes while spending substantially less per capita than we do, it is absurd for anyone to suggest that the United States of America cannot do the same. Summary of the bill. Coverage for all. This legislation will create a federal universal health insurance program to provide comprehensive coverage for all Americans, including inpatient and outpatient hospital care, emergency services, primary and preventative services, prescription drugs, mental health and substance abuse treatment, maternity and newborn care, pediatrics, home and community-based long-term services and supports, dental, audiology, and vision services. What will this bill mean for patients? As a patient, all your basic needs are covered. You choose your doctor. No deductibles, no surprise bills for out-of-network services, no copays. If you change jobs, you don't have to change insurance plans or worry about losing the coverage you and your family depend on. No more worrying about whether you can afford to get the care you need or how to pick the right insurance plan for your family. What will it mean for providers? Healthcare providers can spend more time with their patients and less time with paperwork. A universal healthcare system will also allow the country to invest more resources in provider education and training and make smart investments to avoid provider shortages and ensure communities can access the providers they need. What will it mean for employers? Instead of struggling to provide health insurance to employees, businesses will simply pay a payroll tax just like they do for Medicare now. More freedom, more security. Under this bill, Americans will benefit from the freedom and security that comes with finally separating health insurance from employment. That freedom would not only help the American people live happier, healthier, and more fulfilling lives, but it would also promote innovation and entrepreneurship in every sector of the economy. People would be able to start new businesses, stay home with their children, or leave jobs they don't like, knowing that they would still have health care coverage for themselves and their families. Employers would be free to focus on running their business rather than spending countless hours figuring out how to provide health insurance to their employees. Working Americans wouldn't have to choose between bargaining for higher wages or better health insurance. Parents wouldn't have to worry about how to provide health insurance to their children. Seniors and people with serious or chronic illnesses could afford the care necessary to keep them healthy without worry of financial ruin. Millions of people will no longer have to choose between health care and other necessities like food, heat, and shelter. And that is the end of the document. It's called Medicare-for-all-2019-summary.pdf if you want to look it up. And in that intro, there are many hyperlinks to sources on all of the studies and figures that they provide. Now, before I close this video out, this channel is called Socialism for All, and as such, we try to represent a socialist, Marxist perspective on everything that we cover. This whole question of Bernie Sanders, as you can hear, I think in that PDF explanation of the Medicare for All legislation, there's a lot of talk of like rebuilding the middle class and things that really aren't socialist at all. Social Democrats often point out that it's not socialist at all as like, look, see, it's non-threatening to capitalists. But as socialists, we want things that are threatening to capitalists. Or I don't know if they're saying those things to make it less frightening to workers who have been propagandized by decades of Cold War, USSR is bad type of stuff. It's such a mess. But actually, I guess to cut to the core of it, that is why Socialism for All has lent critical support to the Bernie Sanders campaign. It seems to be building class consciousness much more in a mass way than anything else has done in like a really long time. So we supported for that reason. I guess, and if there is any real potential for getting people benefits, by all means, but the trouble here is just not, I guess, getting the working class thinking that electoral reforms can solve all of our problems and can get us out of capitalism, or even that capitalism doesn't need to be abolished and private property doesn't need to be abolished, which is our perspective. But I guess at the end of the day, I got to say, I've recorded this section a few times because it's just, I don't know, there's a lot of different ways you could look at this. But I think at the end of the day, worry about the rest of it later. People are like just dying in the streets right now to such an extent. I mean, well, people are dying in the streets, but many more who aren't in the street. There are 500,000 people who are homeless, and many of whom are suffering greatly health-wise as a result of that. But many more are just going broke. They're carrying, $500 a month payments out of like medical things. Whatever struggle needs to be done to get rid of capitalism, and I do happen to think nothing short of revolution is going to do that. I do not believe in democratic socialism as a cure for capitalism at all. I think leaving capitalists in power, they're always going to use that power to try to, enhance their own power. And I think that that's probably inevitable. But I kind of feel like separating these questions out, and whatever the risk is of having working class people believing that electoral reforms can end capitalism. I mean, we haven't even convinced them at this point that we need to go beyond capitalism. So this is kind of one of those like, we'll cross that bridge when we come to it type of moments for me, where it's like the Bernie Sanders campaign seems to be actually differentiating working class interest out away from the 1% controlled Democratic Party. That's a positive development where working class people are realizing that they have really separate and antagonistic class interests to the 1%. That's a good discussion. He's also getting people to dare to make demands. And people are starting to imagine, what if things were different? I think we as socialists just need to get in there and keep people looking further down the line. That Sanders is just the beginning of this, not the end. And whatever benefits we get now under capitalism are like nothing in comparison to what we can have after abolishing capitalism. And I think after re-recording this about 7 or 8 times, I'm finally happy with that conclusion. So I'm going to leave it there for now. This has been Socialism for All. Thanks to our one patron so far. We started this channel about a month ago. Already have a patron, so that's great. Like, share, subscribe, comment. All of that helps the channel. We are nearing 100 subscribers on YouTube. We're at like 1,400 follows on Facebook. So keep those coming. Build the channel. Build the discussion around socialism. I think we need to take media away from the merely progressive into the revolutionary. And that's what this channel is all about. Facebook.com/socialism for all. Patreon.com/socialism for all. Thanks very much for listening.